Good morning. Thank you, Alan, for the introduction. This is a very long title, as usual. That my disclosures. For sure, despite the open repair still is the preferred and also the first option for those particular pathologies, we had the opportunity to get a consensus document from the European Association of Cardiothoracic Surgeons, European Society of Vascular Surgery, that gives the opportunity to endovascular believers to treat unfit patients for open repair with these new devices, endovascular devices, just in centers with adequate volume and expertise in open and also endovascular repair. So the relay branch is already introduced by Kuratani, Dr. Kuratani, previous speaker, is based on the MBS device from terumo aortic, and also with a very wide window that gives us the opportunity to have a misalignment just in the faces of the supraartery trunks and easy cannulation from the supraartery trunks to the two tunnels, as well as near also the opportunity to design with 3 different branches and the up part of the aorta. So the bridging stents are especially dedicated for this particular device with a controlled delivery system, but probably I don't know exactly what is the mechanism about the stroke rate that Kuratani mentioned to us previously, and has also this lock stent technology just to avoid any kind of dislodgement during the over time. So that is one example how you can see here how is located. The window is just in 90 degrees in front of the previous intentioned deployment. So that is an example of how flexible is the misalignment on the top. So there are also the design of the triple branch with a very small few series with this particular device allows to us to treat without bypass. So the early clinical results is nothing new for you, because the most important issue is regarding to the disabling stroke is about 9%. Is the published data collected in this particular slide. 9% of the stroke is for me unacceptable nowadays. So the branch limitations beyond the stroke is up to 10%, but also we have some kind of different kind of maneuvers, pre and also perioperatively, but even though stroke remains a big concern for this kind of techniques in the arch. Endoleaks is another important issue in terms of durability, for sure. We need to face probably the type 1 endoleaks in the future. There are some limitations, so for sure, for anatomical requirements, as well as if you need some kind of concomitant cardiac surgery, like valve replacement or coronary bypass. And the last but not the least, the connective tissue disorders are not a good focus for these particular endovascular devices. So in summary, open surgery remains the gold standard for care. A relay branch platform is expanding the endovascular indication for unfit patients, but the stroke still is a big concern. And improve patient selection and technical skills will reduce stroke rates in the future. Thank you very much.